I'm Dr. Bruce Horswell, the founder and first director of the CAMC Cleft and Craniofacial Center. We are the longest standing approved cleft and craniofacial center in West Virginia, as certified by the American Cleft Palate Craniofacial Association. About 18 years ago, we identified a great need for a comprehensive and multidisciplinary effort to help those babies, children, and families with facial differences right here in West Virginia. Through my 30 years of participation at the national level in our parent organization, the American Cleft Palate and Craniofacial Association, I've become acutely aware of this need and how it should be met at the local and regional level to best serve the many needs of our community. Over the years, our center has steadily grown, and we have enrolled over 400 families, many of whom are still active in obtaining the comprehensive care they need right here at CAMC Women and Children's Hospital. I wish to welcome you to our center, and I am pleased to introduce you to our remarkable team here at the Cleft and Craniofacial Center. We are passionate about our mission and committed to delivering the best care every day to you and your family. Thank you for your time and getting to know us a little better through this video.
As cleft surgeons, we provide a number of surgical treatments that will help your child by reconstructing the lip, the nose, the upper jaw, and palate, or roof of the mouth. However, children require much more than surgery to fully thrive. They need complete, coordinated care provided by a compassionate team of specialists. Our team consists of cleft coordinators, geneticists, speech-language pathologists, dietitians, pediatric ear, nose, and throat surgeons, developmental pediatricians, child psychologists, pediatric dentists, orthodontists, social workers, and cleft and craniofacial surgeons. Our providers work together to give your child comprehensive and complete care. The CAMC Cleft and Craniofacial Center is among the most comprehensive you'll find, with access to specialists you won't find on many other teams.
Hey, buddy. Good morning. How are you? You having a little breakfast? See, he's taking some formula still.
Yeah, he takes about 32 ounces a day.
Okay. We started introducing.
As the team coordinator, I bring the team together and coordinate patient care. I'm the first line of contact for family to make sure your questions get answered, and a ready and willing advocate for children and families.
Cleft lip and palate happens for a number of reasons. Most of the time, there's no identifiable cause. However, for children with only a cleft of the palate, there is a higher association with genetic conditions. So more testing may be necessary to identify other potential conditions. With a higher rate of cleft palate in Appalachia than other regions of the country, our geneticists provide critical guidance to teams and family.
I want you to say, I see the sun in the sky.
I see the sun in the sky.
As the team's speech-language pathologist, it is my role to determine if a speech difference is present, what the nature of the difference is, and closely collaborate with our team so that we can develop the most comprehensive and appropriate treatment plan for your child.
So how's he been eating?
He's doing really good. He doesn't take baby food, but he does take what we eat, and he does pretty good with it.
Babies born with cleft lip and palate may have difficulty gaining weight and growing adequately. As the team pediatric dietitian, it is my role to help mothers and caregivers ensure that their babies grow well by utilizing different feeding techniques and increasing calories if needed.
Our pediatric ear, nose, and throat, or ENT specialists, are integral to complete cleft care. Children born with a cleft palate have a higher rate of ear infections, with associated hearing loss and speech development. Children with clefts may also develop sleep disorders, breathing problems, and swallowing difficulties. These problems can be screened and managed by the team ear, nose, and throat specialist.
When your child has a cleft, and that cleft extends to the part of their jaws that hold their teeth, those teeth could be either missing, crowded, misshapen, or have a higher risk for cavities. pediatric dentists can identify those problems early and ensure that your child has proper access to dental care, either by the cleft team or by pediatric dentists near you. We want to make sure that your child is set up for dental success.
Well, you did a great job today. Thank you so much for coming to see us.
Team orthodontists work closely with the dentists and the surgeons to align the teeth and prepare them for future surgery. This is typically performed during adolescence and the critical growth phase. We meet as a team and collaborate to come up with the best possible plan of treatment for the patient, the parent, and the team.
Children with facial differences experience greater challenges during the developmental years. As a child psychologist, the developmental pediatrician and I screen children during these early childhood and school years to determine if there are particular emotional, learning, or social issues your child may be facing. We are a critical resource for children and their families as they navigate the changing developmental challenges of childhood.
Social workers attend every team meeting to make sure children and families have access to many of the helpful resources that are available to them. For each case, our providers take turns visiting with families. After everyone has had a chance to visit and discuss their concerns, the providers meet face-to-face to discuss the child's condition and make recommendations for future care in a collaborative manner. As a result, we provide our children with the individualized care they need.
Helping children with facial differences is what we're passionate about. It's the reason this team was started, and it's the reason we'll be here for years to come.
The CAMC Cleft and Craniofacial Center provides total pediatric facial services. The center is located in Charleston in the medical staff office building behind CAMC Women and Children's Hospital. Call 304-388-2950 for more information.